I'm still going to be sore. I'm still going to be traveling with a heating pad. I'm still going to make sure that I have my steroids on board. I'm going to taper off of them as indicated. I'm still going to be doing all the things, but the really acute emergent pain is now down. And I didn't think it was going to be by the time I recorded this. I was still going to record it and tell you what all I was doing, but I just kismet that it worked. And, you know, God answered my prayer because I prayed for this. I was like, I need to be able to pack pain-free, and I need to be able to get on that plane confidently and not scared. So anyway, that's awesome. A couple things before I leave you. When you herniate a disc, the world is not going to end. Okay. I know everybody leads you to believe it's going to end. I know the pain is blinding and it is intense and insane. My advice is get on a Medrol taper pack as soon as humanly possible. Go to your doctor and ask for a prescription. Now, a chiropractor is going to probably be able to help you to some degree manually, but when it's so spasm, they may not be able to do much. I've been using a TENS unit. That's been very, very helpful to me. I will totally tell you that. I'll make sure that I have it in my Amazon store, and I'll give you the link to my Amazon store. The TENS unit has been on my back nonstop, and I've used it constantly. So I do believe in some kind of e-stim, and you can buy a TENS unit very inexpensively from Amazon or wherever, but your chiropractor is going to have some really cool tools too that is going to get your pain down. I highly encourage a visit to the chiro. I don't have a relationship set up with anybody here that I could quickly get into, so I didn't do that. I wish I had. So that's step one. But step two is get someone who can prescribe drugs to give you a Medrol taper pack, because it's going to save you from that nuclear fallout that is your immune system attacking the nucleus pulposa and causing all that neurologic damage. I firmly believe it will help. At the end of the day, you will be better off doing the Medrol taper pack. Plus, it brings your pain down. And we want movement, right? Like, we need to get the patient out of pain so that they can start moving. When the pain's everywhere, all at once, you can't see straight. You know you're getting better when it starts to centralize, where you can say, you know what, it's here and it's here. So it goes from being this big enigma of horrific pain. So a shoulder, for instance, you'll get pain. If you've ever really hurt your shoulder, you get pain up into your jaw, into your eye sometimes. It's all over. It's down in the back. It's in the rhomboids. It can be in the armpit. It can be down into the ribs. And then as soon as the patient's like, the pain's here, I'm like, oh, that's so much better. We're in such better shape. So yesterday, my pain started centralizing, and I was able to actually put the TENS unit where I needed it more specifically than this whole, like, I don't even know where the pain's driving. I knew what level the disc was at, but the TENS unit was even too intense, even at a low setting, to get anywhere near the disc. I couldn't touch my skin. I couldn't apply pressure. So when things start centralizing, Yahoo, use your TENS unit. Everybody should have a TENS unit in their house. The way it works basically is it turns off the pain gate. Your brain, so like injury happens, let's say in your hand, it travels up to your spinal cord. In your cord is a gate. That gate is either open or closed. This is like kind of a kindergarten version. It's not this simplistic, but it goes up to your brain. Your brain's actually registering the pain. Without the brain, your hand wouldn't feel the pain. If you touch something registering the hot, your brain is via your spinal cord. And TENS units basically shut the gate. So they allow you to continue through mobility and to continue moving, which is going to help you heal so much faster without feeling all the pain that you would otherwise. So everyone should have a TENS unit. I firmly believe it. I carry it in my pocket. I can do so much with my TENS unit. I love it. I have a little tiny one that I travel with. It's amazing. But I'll put a good one that's pretty user-friendly in my Amazon store. And then back to the Medrol pack, it gives you that ability to have mobility. And that mobility is what's going to save you ultimately. I firmly believe that. The sooner you can start moving and the sooner you can start getting range of motion back, the better off you're going to be. So don't be afraid. You might even be getting sharp shooting pain. You might be getting numbness, tingling, and weakness. I was getting both, but it wasn't severe. It was coming and going. So it was intermittent. So I was like, okay, this is manageable. What you are concerned about is motor loss. So all of you doctors listening, all you healthcare professionals listening, and the public listening, your disc herniation is not the kiss of death. I have taught this to countless doctors when I have lectured or trained them in different injection therapy modalities that I specialized in. And most did not know this. Chiropractors know this, neurologists know this, orthopedists probably know this, but most doctors think, oh, herniated disc needs surgery. Oh, numbness, tingling, and weakness, sharp shooting pains need surgery. No, you don't. When you do surgery, you are going to make the region more unstable. So your risk of herniation in the region is going to increase, and then the segments above and below are now going to become significantly more unstable. We have an old adage in orthopedic medicine: orthopedic surgery begets more orthopedic surgery. So sometimes you need your disc snipped off, and I understand that. But if you can get through this, especially with the use of some peptides that are going to regenerate you, I probably am going to be traveling to see a friend to get some PRP, some prolotherapy, maybe some stem cells or exosomes injected to the region to stabilize it once this heals up and calms down. There's all these things you can do. And I know when you're in the heat of it, it can be really, really concerning. But if you start having motor loss, meaning you might have a low grade herniation and you're like, I'm fine. And then all of a sudden the patient comes in and one calf is much smaller than the other one. They're having atrophy because they're having motor loss. The motor signal to the muscle is not getting through. That is very concerning. Okay. Foot drop might be another one. Loss of bowel or bladder, or unable to hold or excrete. Any kind of motor loss is when you get very concerned. That's when we're looking at surgery. And absolutely, 100% non-negotiable. We need to deal with that. But if there's no motor loss or atrophy or loss of muscle, like I even had my L5S1 disc really caused some transient, and I'm talking transient, like pretty long-term gluteal atrophy. And I still deal with some low-grade gluteal atrophy. I mean, that's why I was so proud of myself for building a booty.